Morning, everybody. So today we're going to be talking about therapeutic exercise program. So how do we rehabilitate athletes coming back from surgery, from injury, getting them ready to return to sport after those events happen? Today is probably not going to be as long as the last couple have been. This is chapter 8 in the text that I've shown you in the past, and so we're going to get right into it. Again, slides go along with the video, and I will let you know which ones we're going on. So on slide 2, we're looking at Introduction to Therapeutic Exercise. The ultimate goal of therapeutic exercise is to return the injured participant to pain-free and fully functional activity. In order to accomplish this, attention must focus on modulating pain and restoring normal joint range of motion. You want to look at kinematics and flexibility, muscular strength, endurance, coordination, and power. You also want to look at the unaffected limb, like we've talked about in the past, and looking at the cardiovascular endurance and the strength of that limb, because you need to be monitoring that as well. We also look at psychological influences. They can inhibit or enhance an individual's progress during therapeutic exercise. Awareness of their physical, psychological, emotional, social, and performance factors are very important. Those things can affect the individual during the rehabilitation process, and making sure that it's on track is essential. An understanding of each of those components is necessary, and then you want those to be individualized as well for each person. So in this chapter, in this section, we're going to look at emotional and psychological factors that may affect injured individuals and their progress through the rehabilitation process. We're going to look at therapeutic exercise programs following the SOAP notes that we talked about before. We're looking at phases of therapeutic exercise, including criteria used to determine when an individual is ready to progress to the next phase. And then we're going to look at practical application a little bit. At the end of these slides, I shared a progress of a rehab from all the phases, and you can look through that. But we're also going to go into more practical application of those in different body segments starting next week when we begin going in depth at each joint and each pathology area. So not too specific in this chapter, again, more of an overview. We're going to look really in depth at phases 1 and 2, and then we're going to talk about phases 3 and 4 and how those you start to facilitate your sports medicine umbrella and or facilitating care out into other individuals. So on slide 3, we're talking about the psychological aspects of the injured athlete. For many individuals, the development and maintenance of a physically fit body provides a focal point for social and economic success, and that's very important to their self-esteem. When a participant in a sport or a physical activity sustains an injury, it can be a devastating experience for them. Therefore, therapeutic exercise must also address not just their physical needs, but also their psychological and emotional needs as well. So in general, we look at 2 models that characterize an individual's adjustment to injury. We're looking at the stage model and the cognitive model. So first off, the stage model, or that perspective, is often linked to the stages of grieving when an individual progresses through loss. Those stages will include denial and isolation, anger, bargaining, depression, and acceptance. Although this model has some intuitive appeal, it's not stood up to like peer-reviewed journals and things like that, but I have seen athletes go through these stages of grieving for their injury, for maybe their loss of sport, and it is a very real thing for us to understand. But more recently, the cognitive model has been used to explain psychological aspects of injury and the athlete's perception of injury. This perspective suggests that each person reacts differently to an injury, depending on his or her personality traits, their coping mechanisms, and both personal and situational factors. Personal factors can include performance anxiety, self-esteem or motivation, whether they're extroverted or introverted, psychological investment in the sport or physical activity. You want to look at coping resources, history of past stressors. If they've been injured before and it did not go well, that could be something that stresses them. Timing of the injury is a big thing. Is it right before postseason? Is it going to inhibit them playing for the rest of the season? Those factors are very important. So each of those factors interacts with the cognitive, emotional, psychological, and behavioral responses of the athlete, and that will influence their success or failure within a therapeutic exercise program. So here we look at slide 4. We go to strategies to assist athletes and physically active individuals that go with their injury. So we want to talk about how to help them in different areas of their how to help them through that injury. First and foremost is education. It's imperative that us as the clinicians inform the individual about their injury and talk them through their recovery process. The use of a specific treatment, you want to talk them through what that might look like. You want to let them know that you're setting goals for them and you talk through those goals and you make those goals with them. And then you also want them to know any side effects or sensations that they might be experiencing. That will help the individual understand the management and the rehabilitation process. That way they won't be surprised by anything that might come up, and then it can also hopefully reduce any anxiety that they might be experiencing. The next one is goal setting. It's an effective technique used to provide guidance, and it increases motivation during recovery. This practice helps to guide the individual's efforts. It provides a sense of control that may enhance their motivation. It can help their persistence and their commitment to the rehab program. Individuals who set specific personal goals in each rehab stage will exhibit more success, hopefully. It can increase their self-efficacy or their sense of having power to produce intended outcomes, and they experience greater satisfaction with their performance as well. They also develop more trust with you if you're talking about their goals with them and not just walking them through different steps. In order to achieve success, that genuine relationship is important with the patient, and you want to listen intently for clues that indicate what the athlete might or might not be feeling about those goals. They should be realistic, they should be objective, they should be measurable, and they should be attainable. Long-term goals can reduce the individual's fears of the unknown, but they don't do very much to motivate the individual on a day-to-day basis. So in that respect, short-term goals should be established to serve as daily motivators, and goals should be personalized and they should be challenging, but they also need to be realistic. A timetable for completing those goals needs to be established and they can be measured to monitor the athlete's progress. We're going to talk about goals on the next slide as well. The next one for a strategy would be, we want to talk about fear of risk-taking. So most individuals experience some level of fear and anxiety of the unknown. In a therapeutic exercise program, those emotions can block the individual's ability to work hard at meeting their challenges of the exercise program or meeting their goals. For example, fear of increased pain or discomfort or re-injury during exercise can limit the individual's motivation to exert full effort. And constant positive feedback from us as the clinician can help to overcome some of those obstacles. The last strategy we want to use is social support. So the injured patient needs to feel as if they are important as non-injured athletes and not feel alone or isolated. Their friends, colleagues, coaches, and us as the athletic trainer can provide emotional support and informational support to help the individual recognize their progress and their value to others. It is important to stress the individual's value as a person and maintain his or her connections to friends and family, connections to the team, making sure that they can participate in certain aspects of practice or being a part of the team and how they can support the team during their injury. is very helpful for athletes. So we're going to look at slide 5, and we're going into the guide to goal setting for therapeutic exercise. Setting goals is something you should have covered in other courses, but I want to make sure that we go over them again because it is a huge part of this rehab process. So first and foremost, goals need to be specific and measurable. You want to make sure the patient knows exactly what to do and be able to determine how their gains are being made. So you want to measure progress and document those things on a daily or weekly basis so that the athlete can see that they are making progress. Goals should be stated in positive versus negative language. So an athlete knowing what to do will guide their behavior, but knowing what to avoid will create focus on errors without providing a constructive alternative. So if they're looking at what they need to avoid, they're going to be more cautious, they're going to guard a little bit more, and so that negative language is not helping them reach their goals. Their goals should be challenging but realistic. So overly difficult goals can set up the individual for failure and they pose a threat to the individual. The lower the individual's self-confidence, the more important success becomes, and then the greater the importance of setting attainable goals. So if their self-confidence is low and then success becomes more important, they stress about that success and then they're thinking more about those negative things, which results in negative gains, negative outcomes of their goals. So you want them to be challenging but also realistic and encouraging them that they can reach those goals. You should have established a timeline for completion of these goals, and this allows a check on progress and evaluation of whether realistic goals have been set. So goals are very flexible. They need to be flexible, and thinking that just because a goal isn't attainable at one point doesn't mean it's not going to be attainable ever. The next one, goals should be categorized as short-term, long-term, and intermediate goals. So you want to have a comprehensive program that links daily activities with expectations for specific competitions, as well as for season and career goals. So these go for any rehab, whether they're coming back from surgery or they just got hurt in practice and they're out for 2 or 3 days. You still want to have these set out goals because returning to competition and what that looks like for them helps them visualize the rehab process a lot better. You want to make these goals personalized and internalized. So the patient needs to embrace those goals as their own and it's not something coming from the outside. If something doesn't feel right for them, it's not going to go well and it's not something we can force on them. And so they need to really internalize those goals and make them their own goals as well, not just our goals. Goals need to be able to be monitored and evaluated. So we need to have feedback and provide feedback to the athletes in order to assess their goals, and the goals should be modified based on that progress. And so they need to be able to see that they are making progress. This can be done with measuring range of motion, measuring swelling in those early stages of inflammation. How much weight can they lift when we get into different phases of the therapeutic exercise program, and just finding different ways to provide feedback to all of those things. And then the last one, we want to link their goals to their life goals. So this identifies sport and rehab as learning experiences in life, and it helps the individual to put sport and physical activity in a broader perspective. I have worked with an athlete who had an injury, and then that meant that they could not continue doing their sport ever again. And so this one was very important for them because it gave them a bigger perspective of, you're going to be able to bend over and pick up your kids someday. You're going to be able to run and walk and play games with your kids or your dog or things like that. And so keeping those life goals in perspective is also very important. The next one on slide 6, we're looking at psychological influences of a rehab program. The first one, and so there's 5 factors that can significantly influence the rehab process, and the first one is the biggest one, I think, and that is confidence. There we go. So it can be the most critical factor to a complete and timely recovery. Low confidence can lead to all kinds of negative thinking, negative self-talk, and then that can turn into increasing anxiety. It can turn into um, negative emotions, and that affects low motivation, which can interfere with the individual's focus. So we look at program confidence, which refers to the strength of the individual's belief that the rehab program will enable recovery and is significantly influenced by the clinician's confidence in the effectiveness of the program. So we need to know, or the athlete needs to know, that we are confident in the program that we have given to them, and we know that they're going to reach those goals. The next one is adherence confidence, and that refers to the individual's belief that the prescribed exercise program can be completed. So that factor can be enhanced by informing the athlete that application of skills learned in other areas, such as goal setting, can heighten success in the rehab program. Next is physical confidence, and that's knowing that one's body is capable of handling the demands placed on it during rehabilitation and competition. So responding well to the rigors of the exercise program maintains a positive attitude about the ups and downs of rehab, and then you can also use imagery to enhance that factor. And lastly, we have return to activity confidence, and that relates to the individual's belief that his or her return to competition is at a level equal to or better than where they were before their injury happened. Next, we look at motivation, and motivation has the greatest influence on adherence in rehabilitation. So low motivation can result in poor attendance, incomplete exercises, low effort and intensity, lack of attentiveness to instructions, undefined goals, using unspecified pain to avoid exercise, and insupportable excuses. Motivation can be enhanced through goal setting by reminding the athlete that the rehab is a type of physical performance. They're improving their commitment, they're providing clear direction and the means to achieve a full recovery. And then high motivation builds confidence, it reduces anxiety and the perception of pain, and it refocuses the individual's attention on the positive rather than the negative aspects of rehab, which we talked about before. Next, we look at anxiety. And that is the negative and threatening psychological and physical reaction to the injury. It produces a wide range of physical, cognitive, emotional, social, and performance problems. And it can be caused by a number of factors, things like pain, slow healing, low confidence, pressure from others, which could be parents or teammates or coaches, and then lack of familiarity and control of what's happening to their body. The routine of rehabilitation can benefit recovery by encompassing all of the activities necessary for total preparation, including reviewing the goals for that day, mental preparation to ensure prime confidence, motivation, intensity, and focus, and then their physical preparation, such as stretching and warming up. All of those things can help reduce anxiety of an individual. Then we look at focus. If an athlete is not focused on their goals or on where they're trying to go with their therapeutic exercise program, then their ability to progress quickly or progress effectively could be, negatively affected. Focus differs from concentration in that concentration is usually linked to the ability to attend to one thing for a long period of time, but actually focus is the ability to attend to various cues occurring simultaneously and to shift focus when the need arises. And then lastly, for this section, we're looking at pain management. So pain can be the most debilitating obstacle to overcome during rehab. It can have significant physical, psychological, and emotional consequences. Physically active individuals must be able to differentiate between benign and harmful pain. Benign pain is characterized as dull, generalized, it's not long-lasting after exertion, and it's not associated with swelling, localized tenderness, or long-term soreness. In contrast, harmful pain is characterized as sharp, localized to the injury site, experienced during and persisting after exertion, and is usually associated with swelling, localized tenderness, and prolonged soreness. So then we want to move into actually developing a therapeutic exercise program. And again, for this, we're not going to go super in-depth. If you go into a program, this is going to be something where you'll have an entire quarter or semester of class on. It can be very extensive. It's very different for every joint in the body. And so this is just going to be a general overview of what we're looking for, the phases of therapeutic exercise, and what a rehab program can look like. So during the development of a therapeutic exercise program, the first thing you want to do is assess the patient. So this is the S portion of a SOAP note. And this includes their primary complaint, their mechanism of injury, characteristics of their symptoms, any functional impairments that they might have, and previous injuries to the area and their family history. So you're just looking for anything that they can tell you about the injury that they've had. The objective evaluation can establish a baseline of measurable information, and that's recorded in the O portion of the SOAP note. And that information documents the visual analysis of the injury site, looking at symmetry and appearance. This section can determine the presence of a possible fracture. It identifies abnormal clinical findings in the bony and soft tissue structures, and it measures functional testing, ligamentous and capsular integrity, neurological testing, and sport-specific functional testing. So the dysfunction of the injured body part is always compared with the non-injured body part in order to establish bilateral comparisons. Next, you want to interpret the assessment, so looking for primary deficits or weaknesses within the affected limb, and then organizing a priority list of concerns. So deficits can include, oh man, I lost my place. So examples of major concerns, deficits that you want to look for are decreased range of motion. You want to look for muscle weakness or stiffness, joint contractures, sensory changes. The inability to walk without a limp is a huge one that you're looking for here. And then increased pain with activity. Physical assets are then identified to determine the individual's present functional status. For example, normal gait and bilateral equal range of motion should be documented and looked for. Specific problems are then recorded in a section called the problem list, which is also part A of the SOAP note. Next, you're looking at establishing goals. Long-term goals are established for the individual's expected level of performance at the conclusion of the exercise program. These goals typically focus on functional deficits in performing daily activities, things like taking a shower, washing your hair, getting in and out of the car, are those daily activities that you're looking at. Short-term goals are developed to address specific component skills needed to reach those long-term goals. So the athletic trainer and the patient should discuss and develop those goals together. Then you want to look at developing and supervising the treatment plan. So any therapeutic exercise and modality used to achieve the goals is recorded in the P section of the SOAP note, or the plan. In order to return the individual safely to participation, the therapeutic exercise program is divided into 4 phases. And then the termination of one phase and initiation of the next phase can overlap in certain areas. And then lastly, we want to reassess the progress of the program. So short-term goals should be flexible enough to accommodate the progress of the individual. For example, if therapeutic modalities or medications are used and the individual attains a short-term goal sooner than expected, a new short-term goal can be written. Some conditions, however, such as edema, a hemorrhage, Muscle spasm, atrophy, or infection can impede the healing process and delay attainment of a short-term goal. So periodic measurement of girth, range of motion, muscle strength, endurance, power, and cardiovascular fitness can determine if progress is occurring. If progress is not seen, then the individual should be reevaluated. And then the athletic trainer must determine if that delay is caused by physical problems that the athlete is having or by psychological influences necessitating referral to an appropriate specialist. The individual should continue to progress through short-term goals until the long-term goals are attained and the individual is cleared for full activity. All right, so those are the basic coverage of a therapeutic exercise program, getting started, what the components are, and what they look like. I'm going to upload another video later today that's going to go through, it's going to continue on through the slides, and we're going to look at the phases individually. I just wanted to make sure I got this one to you guys first, and then I'm going to upload a second one that will go with this later. It will have a rehab program attached to it. It's going to go through each phase of a rehab program, and then it's going to outline what your assignment is going to be for this week. If you have any questions, let me know. I will upload the slides for you, and then that second video should be coming either late tonight or early tomorrow morning.